Having previously worked for nearly 15 years overseas in United Kingdom, but also having worked in India for a short period of time, is the cost and the access to medicine. Knowledge-wise, I do appreciate the the staff and the knowledge is there to deliver the care, but the access that patients have are limited to what they can afford, and the money is a big factor in the decision making. The understanding of chronic diseases or non-communicable diseases is not completely established. They feel diabetes is short-term, they feel the diabetes is curable. But at a very young age, they are encouraging healthy behavior, healthy eating, healthy practices. And the program's been implemented at the school level, primary school, secondary school level. Collaboration. There's a lot more willingness in a general healthcare setting, that there's more willingness from staff, from people from different sectors within the healthcare environment, that they want to come together, they want to promote healthy practices, implement implement programs that encourage healthy behavior, screening, advanced treatments, and working collaboratively to aim for better patient outcomes. The patient behavior, the education, the awareness, not education per se, but the awareness is not as much, and that impacts the behavior, especially regarding health education, is not as strong, not as rigid as you see in other countries. And making a small change for example, in the curriculum will have a big impact, not just today, but also in the long term, in the future 50 years, especially as Kenya is growing as an economy. So there's a lot of variation, there's not much standardization, and that's something I miss a lot. The practices that is done in Mombasa, for example, is very different to what people are doing in Nairobi and what people are doing in Kisumu or people are doing in Eldoret. In terms of infrastructure, some of the basics are also a problem. If I had an emergency, getting to the hospital is the fastest way is to get your own transport. These are some of the basic things that we can work upon, we can aim to change. Make the healthcare sector so powerful that the population has confidence in it, and also the quality you can rely upon. You don't have to go outside to get the same care where you can get it locally, and that should be widespread. That should be a bare minimum, a high standard. You should try to build on certain incentives for healthcare workers to continue working, continue learning, continue experiencing, and benefiting from their experience within our country, rather than losing that talent to external countries. They're not able to attract them, to keep them, or to retain them. There's a lot of learning, there's a lot of experience, there's a lot of knowledge that we can share. So one of the ways we learn a lot from each other, that's known fact, that's a historical fact. We know what's happened, we know what's happening elsewhere, and we try to implement those ideas. It's starting to become much more prevalent in Southeast Asia, South Asia, and Middle East. You're getting a lot of very useful practical data that can benefit the patient that we are seeing. So that there should be, especially from the medical training, from medical college, from medical officer training and intern training. There should be an encouragement, and there should be incentivization of encouraging people to pursue academic pursuits, including research, being able to have a channel for them to publish and make it easy for them to publish. In order to collaborate with others, it can't be a one-way information channel. We need to share our data as well as take their data. So the talent, of the medical teams here are quite exceptional. There's a drive. There's a drive that people want to provide a good service. There's a lot of passion among the staff and the people, and among clinicians, among different sectors. I see this in the medical meetings, scientific meetings that we have, in the local institutional meetings, regional meetings that we have, and there's a lot of enthusiasm that people share. It's just we need to keep it here.